Now we're live. So
We're live.
We're live.
We're live.
Hey guys, my name is Chris Channa, the owner of Chelsea Place Senior Care and your host of Senior Source TV. And today we got a special friend, Pam. Is it Manier?
Manier.
Manier. I feel like it's like a fine wine or something like that, you know? But we got Pam from Grand Care Plus, and today we're going to go through three ways or three things that you should think about when you're choosing a home care agency. Pam owns a private duty in-home care agency called Grand Care Plus, and so Pam, one of the questions I think a lot of times when family members are going through this, because a lot of us know what home care is,
right.
Like we have a general idea of maybe what services they provide, but you know, what is when you're trying to choose which home care, or just even when I want to choose a home care agency in general, what are some things that I should be asking that home care agency, you know, to learn more about, to make sure that as a client or a customer, you know, that I'm asking the right questions, or you know, whatever the case may be. I mean, how do I choose one of these agencies in my area?
Well, I think the first thing you should do is just make sure that the company that you are choosing, make sure that the caregivers that will be going to your home are being thoroughly screened.
Right.
Making sure that they have.
But when you say screen, though, what are some qualifications or screenings that are, I guess, either required or important, you know, for home care? Sorry, I was like, I saw the phone was going off, and so we got a baby on the way. So every time a phone rings or something, I'm like, who's calling? You know. But anyways.
Oh, that's funny. So the screening, the state requires a level 2 background check. You know,
Right.
it's a fingerprint. They get fingerprinted, and it goes off to the state, and the state will notify you if they are arrested for a felony or charged with a felony. So for that, which is good.
Now, is every person that works for a home care agency, are they required to have a
Yes.
level 2 background check?
Yes.
Okay. So but you're saying that they're only notified, or the company itself would only be notified if that person had committed a felony or
Yes,
something?
correct.
Okay, gotcha.
Correct. And the company gets an email from the state stating that.
Right.
Which makes them unqualified to be a caregiver.
Gotcha. Yep.
But for me, I think that it's smart to go a little bit more in depth and just make sure that they have a clean driving record, to make sure that they have no arrests for domestic violence or for DUI.
Gotcha.
Because those are not felonies.
Right. Right. And so you're saying that like those particular things might actually get might go under the radar. We may not be alerted as a home care agency,
Right.
If someone were to, you know, be charged with any of those misdemeanors.
Correct.
You know? So you're saying that if I'm a client, it would be important to make sure that I'm asking my home care agency, hey, do you guys do any more than a level 2 background
Exactly.
check? Okay.
Exactly.
Gotcha.
I think that's really good. That's what we do.
Right, and it's good for, you know, because like, you know, a lot of times when we think background checks, I mean, there's all sorts of background checks. There's a background check when you lease a home. There's a background check, you know, for real estate, or for financial services, or for home care. So, and when we think of that, we think that maybe is this all-encompassing thing, or it might just be the automatic, that person's fine.
Exactly.
But we may not really understand like what type of background check, or what does that cover.
And it's good for 5 years. So when they go get their level 2 and they pass, I mean that's good for 5 years.
Right.
And a lot can happen.
Exactly.
A lot can happen in 5 years. A lot can happen in a week. So that's just why I think it's smart.
Sure.
To, you know, take that extra step and do that.
Sure. And then I guess, you know, when it comes to like with home care too, is there anything as far as like, you know, are there any questions that we should ask, you know, as far as making, you know, sure that they're properly insured, or how do you know if a home care agency carries the right insurance? Or
You mean like for us?
Yeah, like I was thinking like you know, because we were just talking about this actually yesterday with the whole auto thing, and when it comes to like insurance, like, you know, like it was interesting because I was sharing with you the story of me reaching out to our home care insurance agent, and that person was stating that, you know, here's your general liability policy, you know, sign here, give me this stuff back, and I'm like, so I just want to make sure, like, can I transport someone to a doctor's appointment, like in the client's car or my caregiver's car?
Right.
And he said, oh no, that's a separate thing. And I was like, what do you mean? I thought I got that a part of the general liability insurance coverage. So it actually was that's how I discovered, you know, these things being separate or whatever. So just, you know, maybe making sure that the person, the family member that's inquiring, that they might need to just ask, hey, is my loved one insured if I'm transporting if your company's transporting my mom or dad, are they insured
Right.
in their car or the caregiver's car?
Or in the house,
Right,
under
exactly,
liability
yeah.
or workman's comp and
Exactly.
stuff like that.
Exactly.
Okay.
And like and workman's comp is important too, because
Oh, for sure.
I mean, when we're transferring people, from the wheel, and if there's one thing I've learned recently is like, you go into these homes, and I'm so used to helping people out in our like environments in
Right.
assisted living or daycare, and it's like, helping someone on and off the toilet in this environment where it's like you have all the safety precautions in place, but then you go to a house and you're like, this house was built in the 30s, and they have this big step into the shower, and there's all this or you're like, how in the world have you been transferring mom from the wheelchair to this toilet safely for the last 2 years? Like that, there's
Absolutely.
nothing safe about that,
Absolutely.
And so I know I've seen, I'm sure you have too, just
Yeah, for sure.
dangerous environments
Yeah.
in the home where
For sure.
it's important to make sure that your girls are covered when it comes to workers' comp.
Right, they are. Yeah, you have to just choose. You just have to ask the right questions, and the questions would be, there's so many different kind. You've got your nurse registries, you've got your home health agencies, and your non-skilled home health agencies.
Right.
And for us, we have employees. Their employees are under our blanket. They're under my liability. They're under our workman's comp. They're under our bond.
Right. Right. So if someone hires you, then they're covered.
As a home health agency, correct.
Right. Like that individual coming into my home, they're protected through your company.
Absolutely.
When it comes to workers' comp, general liability,
Correct.
In auto and transportation and stuff.
And the same goes for nurse registry. The only difference is the independent contractors, the independent contractors have to make sure they have that.
Right.
So they have to make sure that they ask.
Gotcha. So it's really just important to know, hey, is this person covered?
Yeah.
As far as how they're covered might be different.
Right.
One might be covered through the company.
Right.
One might be a policy that the individual holds.
Correct.
But either way, as
Correct.
a client, just how am I covered? And how
Right. And and I'm sure that they make sure that all their, either way, I'm sure they
Right.
make sure their
But
caregivers are covered.
Sure.
It's just what you need to ask.
Sure. And just asking those questions is
Yes, for
important.
sure.
Yeah. What is there a difference when it comes to like the qualifications of maybe like a homemaker and companion agency versus like a personal care agency, as far as like what is required, that the caregivers must complete, or things that they must be trained in? Is there a difference between those two agencies?
Yes, correct. Obviously for a companion, they're not doing hands-on. So the best way for me to explain it to clients when they call is it's either touch or no touch.
Right, right.
So for
right.
companion, yeah, they just need to know how to, like housekeeping, laundry, meal preparation,
Right.
And even transportation.
Gotcha.
So for hands-on, you need to know how to use a gate belt, how to lift and how to transport, and how to reposition, and how to take those safety measures in the showers.
Right.
Or transferring from the wheelchair to a shower chair.
Right. Right.
So that would be, to me, that's the difference.
Gotcha. Which is important. So really, maybe the family just saying, hey, are we just doing the simple like shopping, transportation, doctor's appointments, or does my mom need help with the shower?
Correct. Or getting dressed.
Right. Right. So if there's that hands-on thing, then just making sure like the company I'm reaching out to, like are they able to do that additional service or have that hands-on approach?
For sure.
So and the thing is really it comes down to the family and what their loved ones need, and then really based on where they're at. Like maybe they're not ready for personal care, they don't need that yet. So homemaker and companion services might be sufficient, but maybe down the road they might need that. So
yeah, and also the difference in the companion care and the personal care was that for the companion care, there's not a lot of liability.
Right, right, right.
So again, just ask and make sure that everybody has what they need.
Gotcha. So just make sure that they're covered as well when it comes to liability insurance. So, well, cool. So another thing, I know another question a lot of times that come up are cost and insurance. Everyone always asks, hey, does Medicare pay for this?
Yes, that's the first question.
I know. So like, let's talk a little bit about like maybe the cost, then we'll dive into like the insurance side of it. Or actually, maybe let's do insurance first.
Sure.
So we actually know what does cover it. When it comes to insurance, what covers the cost of home care?
The only insurance that covers what we do, which is private duty, is long-term care insurance.
Okay.
For me, for my company.
Right,
But for
right.
other companies, some take Medicaid.
Right.
but it's limited.
Gotcha. So it might be like limit. Like you meaning you might have to like call multiple agencies to figure out which one of these agencies actually is a Medicaid provider.
Exactly.
Okay.
Exactly.
Gotcha.
And then there's also the VA.
Right.
Several are providers for the VA. I'm in the process of doing that, but and then Medicare.
Gotcha.
Medicare obviously doesn't.
Right. So Medicare does not cover it. Medicaid, depending on the company, may cover it. VA, again, just I guess it goes back to VA and Medicaid. Those two just depend on if that company accepts it.
Correct.
And then long-term care insurance, really anyone that's licensed, I guess, is able to
anybody
qualify
that has
for that.
a license, yes, qualifies for long-term care.
Okay. And then how does that work? If I'm like if I'm have a long-term care insurance policy, how do I go about applying for, or how do you guys work with the how do I know if someone qualifies for that?
So what they do is they give them the company's name.
Right.
And they contact us.
Okay.
And they ask us different questions and license and all the information they need. And then we bill the client. The client pays us.
Right.
And then we take that and we forward that to the insurance company for the client.
Gotcha. So then essentially, like, once they share with that company, then you guys are able to kind of take over and get things set up.
We do. We do.
Right,
yeah, we
right.
do. Everybody does. We do. Everybody doesn't though, because
Gotcha. So
it's
just
kind of bad.
Right. No, I know it's a lot. I know. Trust me.
But we do it for them because
know,
I mean, that's what we should. That's what we should do.
Right. And I know poor Julie, man. She like when she goes through all the long-term care stuff here, it's like
it's exhausting.
I know. It's like it's just there's a lot, and then everyone's so different. Like some will ask for the information. They'll ask for it to be provided like daily.
And the care plan.
Or weekly, or the
I
care
know.
plan, or like,
Yeah.
and they're all different. So there's not like a standardized like billing, and so it's like, okay, which company is this with? Okay, how do they want it? And then it's got to be on the first of the month, and it can't be sent in early, or it can't be sent. It's just
there's a lot of rules
right.
to it.
Or you
that's
might,
for sure.
or you might date it for the 5th, but they want it dated for the 1st, even if you did it on the 5th. It's crazy. So
it is, but it's really good. There's not a lot of seniors that have it.
Right.
So it's really, good that they do have it.
You know what I learned actually? I was at a conference, and I found out that there's 7 million people in the United States that carry long-term care insurance, but there's only 270,000 policies that are active.
Wow.
So there's
That's crazy.
right? I know. So really, it's like I think we're just scratching the surface on people that might have a policy, but then just haven't used it yet. So
correct.
So for those out there that might have a long-term care policy, just look into it and see, hey, what kind of a benefit do I have, for home care?
And a lot of the long-term care insurance, they do not cover respite.
Gotcha. Yeah.
And that's terrible because the caregivers are the caregivers who are taking care of the family member really need that. Yeah. So check your policies.
Yeah. So make sure you read into that, or reach out to your agent, and and maybe they can explain that in more depth to you. So then I guess of course cost is a big thing. I mean we so if someone doesn't have long-term care, or they don't have maybe Medicaid's not paying for it, VA's not paying for it. I guess how does cost work? What are some of the costs associated with it? Maybe the ranges there might be, and then also are there minimums, and is there other, like, I know are there flat rates for certain things? So how does that work?
Well, they go anywhere from 18 an hour to I think 26 an hour.
Gotcha.
Hourly, and
that probably depends a lot on area and like these types of services.
Yes, for sure. That's the best way I can say it. And then there's flat rates for transportation or for maybe shower visits.
Okay.
A lot of companies have minimums. A lot don't.
Gotcha.
So it just all depends on what you need. A lot of people want you to sign a contract. A lot of people don't.
Right.
So
when it comes to like what would be the differentiator when it like with the rate of like 18 to 26? Are there some things that might be like, if someone was getting, like how we were talking earlier, if someone was getting like homemaker and companion care where there was no hands-on assistance, or if someone was getting that hands-on personal care assistance, is there a difference in price maybe for those two? Or
there is, because we have to pay the HHAs who are more qualified and who do more work, more money, obviously.
Right.
So we have to charge the client a little bit more. But same with the companion. The companion are people who have been taking care of people pretty much their whole life.
Right.
And doing the normal daily housekeeping and laundry and meal preparation.
Sure.
So.
Yeah, and that's all. I got you. So just really maybe when you're looking into that, depending on maybe your needs, then that might be a way that you might be able to maybe use a homemaker and companion service if the needs are light and you're trying to save a little money, or if you need that personal care, then just know that it might cost a little bit more.
Right. For sure.
So and then yeah, I guess anything else that you think is like helpful for families to be aware of when it comes to home care?
Just do your homework.
Gotcha.
Just do your homework and make sure that that this is a company that's going to work best for you. We have a lot of really great companies in Charlotte County.
Right.
And so just do your homework.
So make sure if you're caring for a loved one, just don't be afraid to like reach out to other people. Go feel out who you think is best for you.
That's right.
And
that's right.
and then that way you can make that decision and you feel comfortable, with the decision that you made and the company that you chose, and you've done maybe some of your homework with some of the things that we spoke about today.
Yeah, absolutely.
So I guess for those that might be interested in your services or reaching out to you, what's the best way to get a hold of you?
Best way to get a hold of me is my phone number.
Okay.
Because my phone number rings 24/7.
Right.
And
I hear you. That's what happens when you're in the healthcare business,
That's what happens when you're in healthcare business. You could go to my website, grandcareplus.com. You could call me.
And how do you spell it? Is it all one word? Or?
All one word.
Okay.
GRAND. GRANDCAREPLUS.com.
Okay, and then and what's the best number to reach you guys?
My number is 941-916-8586.
Okay, so if you have any questions, make sure you reach out to Pam.
Give me a call.
And Pam, so tell us a little bit of your background too. How long have you been doing this now?
I've started Grand Care Plus. I have 3 years in September.
Wow, that's amazing, man. I remember those early days.
Oh my gosh, I know. Yeah, started companion as a companion, company, and there was such a big call for hands-on.
Right.
So we went to that next level, and then my last amazing venture, I'm kind of hopefully going to start helping the community with some transportation.
Right, which would be
which
nice
really
added benefit. Yeah,
yeah.
Like I said, like the dialysis when you're that like over every 3 times a week. I mean, I sit there and think about those folks.
Gosh,
and
it's
crazy.
It is crazy
because you're literally like married to this place that you have to. I mean, you can't go anywhere.
And there's a lot of people in Charlotte County
right.
that between cancer treatments and radiation and dialysis, more than I ever dreamed.
Right.
And I just feel like that'll be a really good service for them.
Yeah, that's awesome. That's great stuff. Well, I appreciate you coming on today.
Yeah, thank you for having
Glad
me.
we were able to do this. It was funny. I was just telling her earlier. So I was supposed to do Melissa Vanderbilt yesterday, and man, I had like this abdominal like pain that was so bad. I'm like, we're about to get on. I'm like up here, and I'm like, okay, all right, Melissa, you ready? And she's like, are you okay? And I'm like, I don't know. She's like, you want to do something? I'm like, yes. And I'm like, that'd be great. So anyways, we'll make sure we get Melissa Vanderbilt on one of these days here in the next few weeks. But I appreciate y'all joining us today. If you have any questions, if you guys need help finding resources like Pam's or anyone else in the community, maybe elder law, maybe assisted living, memory care, if you just need help finding different resources in Charlotte County, let us know. We'd be happy to help. Our number's right here for that. And of course, thank you again for joining us today. And if you have any questions for Pam about home care, please reach out to her. We'll make sure her information is below, and we'll see y'all soon. Thanks so much for joining us.
Thank you.
Bye, guys.
Bye.
So I never know if like.
God, that was nerve-wracking.
It's all good.
It was nerve-wracking.
I know that.